Hello, my name is Ashley Murphy, and this is my certification video for the use of an AED for an adult, child, or infant. I will be doing a 360 of the room before beginning. And I will film my victim here and the equipment I'm using. In this example, we have been doing the check, call, care sequence, and our AED has finally arrived onto the scene. Before using the AED, I'm going to have somebody plug it in, or I will plug it in myself. I will have the pads here, but they're not going to be plugged into the adapter quite yet until I actually place them onto the victim. Before actually placing them, I'm going to want to make sure a few things are done correctly before starting. So we're going to make sure that the victim is not lying on a metal surface, that they're not laying in any kind of standing water, that they're not in a moving vehicle, and that there's no phones within a 6 feet radius of our victim or the AED. For their skin, we're going to want to make sure that it's as dry as it can possibly be, and that we're not placing the pads on a medicine patch or a pacemaker. When doing the placement and making sure that it's dry, we cannot use alcohol to dry off the body. I suggest using a towel. That would be the best to use. The placement of these for an adult or child is going to be on the right shoulder vertically for the first patch, and on the left side underneath the nipple line with the cord facing the midline for the second one. We're going to then plug in our adapters on our AED. It's going to prompt us that it's going to be analyzing. At that point, I will announce not touching my victim from this point going forward. Analyzing, stand clear. It will analyze. It will tell us every step of the way what we need to do. It will prompt us. In this example, it's not going to prompt us because this is a prop, but we will say that it has prompted us to shock. So what we'll be doing then is announcing shocking, stand clear. We will be then pressing the button that shocks the victim, and at that point, if it tells us to do CPR, or if it tells us to to continue without doing any CPR, we would follow those prompts unless the victim is not showing any signs of life. In the event that the victim isn't showing any signs of life, at that point I will need to start doing CPR. CPR is going to be the 30 compressions at an 18-second rate for then 2 breaths, which will be a second each. So 30 compressions to 2 breaths. For an adult, those compressions are going to be at least 2 inches deep. For a child, they're going to be about 2 inches deep. And for an infant, they're going to be about 1.5 inches deep for those compressions. Again, I want to make sure that the head is tilted, the chin is lifted when giving those breaths, that air isn't getting into the stomach and the chest is rising, that we are not touching these pads, and that we are not touching the victim unless prompted to do so. For a child, if their patches are touching, we're going to treat it as an infant. The infant, I'm going to be placing 1 pad on the front of the body vertically and 1 pad on the back of the body vertically. We will be leaving those pads to do their analyzing even if the victim is showing signs of life, and I will be continuing to do CPR unless suggested to do so by the AED if they are not showing any signs of life, and we will wait for the AED to prompt us to do something different or wait until the EMT arrives on the scene. And that concludes my video for certification for the use of an AED for an adult, child, or infant. Thank you. Have a great